great lineup for today at our center research rounds. I know that people are just beginning to join us, but we have a nice group already. Today we're going to have Christine Cassidy and Amanda Higgins speak to us about exploring the transition from pediatric to adult. And I just, of course, Christine is an assistant professor at the School of Nursing and a clinician scientist at IWK Health. Her area of interest, of course, in addition to transition work is in implementation science. She is the science lead of this project. And I think I will ask you, Christine, to introduce Amanda to us as well, and maybe just tell us about what your format's going to be today for your talk.
Sure. So I'm actually going to hand it right over to Amanda because she is 100% the lead of this work. So Amanda, maybe you want to introduce yourself, tell everyone a little bit about your journey and then what we're going to be chatting about today.
Perfect. Thank you. Can you see my notes right now?
No, just the slides.
No,
Okay,
just
wonderful.
you, Amanda.
Oh, wonderful. I wasn't sure, but wanted to make sure. So my name's Amanda Higgins, and I became part of this study through my membership with the Transition of Care Committee, which we'll kind of explain a little bit, but it's an internal committee within IWK. And I was brought on as a patient partner with this work under Christine, and loved it so much and loved working with Christine so much that now I work on her team as a research assistant and have completely shifted my career path to become a health researcher, which is why I then applied for a grant and had my own project that I will present to you today that I ran this past summer. So we want to acknowledge that the work was funded through a mentored grant with the IWK, as well as we had the support of the MSSU. So first, generally when we think about transition, we think about one moment in time. However, we want to think of someone's transition over a period of time that they're managing well in adult care, not that they're only managing well in adult care, but that they've landed and they've stuck and they're successfully receiving services. So the ideal transition is supported by individual planning, coordinated transfer of care, and secure attachment in adult services. And so we want to distinguish transition from transfer. And so transition is really that time from whenever someone enters pediatric services to when they get secure attachment in adult services. And transfer is just that one piece within their longer journey when they're referred to adult services and then they make that transfer over. They're building skills throughout this whole time that's going to effectively create a successful transition for them. So why is this research and what we did important? And from a patient perspective, this research was and it is so important because there is a missing piece in the puzzle when we think about transitioning to adult healthcare. Once youth hit that magic number of usually 16, the reality of transitioning starts to set in and conversations start happening. And sometimes you feel like you're looking at a puzzle and it's all done except there's one piece in the middle missing and there's nothing left to put in place. But this research really helped conversations happen around how we can all work together to find that missing piece. And then from a transition of care committee perspective, which is the committee at the IWK that brilliantly brings together healthcare providers, caregivers, patient partners, and community partners. And we've heard from youth and caregivers about how the importance of knowing that transfer is coming and that it's a thing helps them to prepare. So as a healthcare provider, you may think you're talking about transition, but it continues to come up as how important it is to be talking about it early and often. And so for the committee, when we look at the research, it really reinforces our need for our key message strategy about transition, that it's a thing we all need to be aware of, and how we can focus on making it successful for each and every family. So some background on the study. So transition processes have developed in different ways in different health systems, and currently there's very little done to standardize the transition of care, which can result in poor outcomes for their youth. The processes may not have been developed in a systematic way or even evaluated, so it's important to understand the local context and the barriers and enablers to care in order to support and improve the transition process. And different care teams and clinicians at IWK, Nova Scotia Health, and elsewhere have researched and evaluated transition in different ways within their own team. And this work with MSSU allows us to look at transition across various care teams. The research project is an MSSU priority project, the MSSU being the Maritime Strategy for Patient-Oriented Research Support Unit. And as the name implies, MSSU collaborates with IWK Health, the pediatric hospitals in Halifax that serves the Maritimes, and the Department of Health and Wellness to support health research in Nova Scotia. Priority topics were selected and research questions were refined at a knowledge exchange event with key stakeholders, and transition from pediatric to adult healthcare became a priority project supported by them. And in many ways, they've helped push this work forward in ways that, as a transition care committee, we could never have done on our own. So the objectives of the study were to explore the practices and experiences of youth, caregivers, and healthcare providers when it concerns the transition to adult care. We use the COM-B, a behavior change framework that looks at motivation, capability, and opportunity, and this helped us identify the barriers and facilitators to the transition of youth from pediatric to adult healthcare. Integrated knowledge translation was a critical part of this research project. And the Transition of Care Committee, which consists of youth that have experience from transitioning from pediatric to adult care, were involved in almost every part of the transition or the research project. And this created a richer result to help ensure the findings will be used to enhance clinical care. We reviewed the research questions for the focus groups, respectfully tore them apart to make sure that they were appropriate for the participants, but to more importantly ensure that we got the information about transition that would be most useful to us as a committee. We also helped analyze the findings, and this discussion provided opportunities for youth on our own committee to see how important it was to learn self-advocacy skills and allowed clinicians to appreciate the important role that they have in the approach they take to transition, most importantly around the language and the metaphors that they use when they're discussing transition with their patients. And in these ways, the integrated knowledge translation approach had unanticipated impacts within the research partnerships. And now Christine is going to take us through the theoretical framework that guided the research.
Thanks, Amanda. So Amanda mentioned earlier that we use the COM-B model of behavior, and this is the theoretical framework that's part of a larger framework known as the behavior change wheel. And that is used quite extensively to guide the design of health interventions in health services research. And it's based on the principles of this COM-B model. So the COM-B model suggests that for an individual to change their behavior, or for a group of individuals to change their behavior, there must be some sort of change in their capability, their opportunity, and/or their motivation. So capability meaning knowledge and skills to change the behavior. Opportunity, those are the influences of social relationships, environmental context and resources. And then of course, motivation influences things like worry, concern, what your goals are, and who you are as a professional or personal identity. So we use this model to guide our work extensively, from assessing barriers and facilitators, data analysis, and reporting the findings. So a little bit more about this work. We conducted a qualitative descriptive study with interviews and focus groups of youth, caregivers, and healthcare providers. We specifically looked at the patient populations in the clinics with diabetes, inflammatory bowel disease, and juvenile pediatric arthritis. And those foci were chosen based on another quantitative stream of this work that we're not going to discuss today, where we're looking at healthcare utilization rates. So we used a semi-structured interview guide that was informed by the COM-B model of behavior to explore the barriers and facilitators within each of those components of capability, opportunity, and motivation. We then conducted a directed content analysis guided by that model, followed by more of an inductive thematic analysis to identify themes related to those barriers and facilitators. And we had great support from the Transition of Care Committee to help with interpretation of our findings. So the next slide shows who were our participants. So we had 9 youth with experience in transitioning from pediatric to adult care, 8 caregivers or parents, and 26 healthcare providers that participated in the interviews and focus groups. On the right-hand side of this slide, you'll see that of the healthcare providers, 15 were adult or pediatric nurses or allied health providers, and 10 were adult or pediatric and primary care physicians. So I'm going to walk us through some of our key findings, and just want to mention some limitations at the outset that you can consider as we move through this work. So this project started before COVID, but quickly became a COVID study. And so we had some recruitment challenges. Fewer primary care providers and youth participated than we had originally planned, but we did recruit enough youth participants for our qualitative analysis. And we also recognized that we had very few youth from equity seeking and historically underrepresented groups. And our research or interview guide questions didn't include health equity specific questions. And so that wasn't part of the data collection or data analysis, and something we recognized and learned more about as we were moving through the research process and identified this as a critical need as a next step in some of our work and some of our research. So to start off with the youth findings, we had 3 main themes related to the youth participants. And these were health literacy to support the transition process, this concept of readiness for independence, as well as health system coordination. So as part of the transition process, youth described developing health literacy skills. And this was related to their diagnosis, but also about the transition process. And so having those health literacy skills were seen as a facilitator to the transition process. Youth also really described the pivotal role that caregivers played in this incremental preparation for transition over time. And so they described this as a soft launch if there was that incremental preparation. What was really interesting is that many of the youth were really motivated. They wanted to develop their independence. They wanted to become more of a self-advocate as they transitioned into adult care. In terms of health system coordination, at that system level, youth described having an approachable adult care provider that they had an opportunity to meet with either at a transition clinic or a transition meeting where their pediatric provider was present as well as their adult care provider. And this was seen as a real facilitator for a positive transition. Youth also described their relationship with their pediatric provider and the impact that that could have on their transition experience. So when pediatric providers maybe shared some negative views about the adult care system, this would create fear and anxiety among youth. Whereas when pediatric providers, described the transition process as a natural next step, part of the continuum of care, and really supported youth to get connected to adult care, this was seen as a facilitator. So youth really just described, what does a successful transition look like? It's an experience of seamless, fluid process that involves positive relationships with both pediatric and adult care providers. So the next slide just provides a quote that really speaks to the theme around making that connection with different healthcare providers. And so Amanda's going to reflect on some of those findings from a youth partner perspective.
Thanks, Christine. So as we mentioned, the more that we talk about transition, the better. There are transitions that as youth we know are coming. So when we go from middle school to high school, we know that's coming. We know we can get our license at around 16. We know we're going to pick a direction for ourselves when we graduate high school. But this transition from pediatric to adult services isn't always discussed. It's not something everyone's going to go through. And when it's not brought up, it's almost like we're being blindsided in a way, and that's not helpful for anyone involved within the process. So bringing it up early and as often as we can is the best approach. The readiness checklist works. And so this is a checklist that's used in clinic in the pediatric hospital. It can either be brought up by the healthcare provider or the youth and their family. And the checklist is composed of many self-management behaviors that would be needed for transition. So some of the examples are knowing the names of their medications, knowing that if they get sick, where they can go for help, and also spending time alone with their healthcare provider at each appointment. Communication with everyone involved helps, and speaking to all the healthcare practitioners on a youth team, if that's applicable, and also involving their primary care family doc has been seen as helpful. Speak with the youth first and then again with their caregiver. In our latest You're in Charge session, which is a program run within the IWK to build some of these self-management behaviors, one of the biggest area that youth expressed interest to build in is to ask questions to their healthcare provider. And so we mentioned to them that even if at the beginning it's asking questions to their doctor about their favorite color or what they did on the weekend, soon those questions become about the side effects of their medications or complications from their diagnosis that they're experiencing. And next, we're going to go through some of the caregiver findings.
Thanks, Amanda. So the main themes that we identified for the caregiver focus groups were related to playing a supportive role in helping their youth to develop this concept of health literacy. Caregivers also experience a transition of their own, a transition of responsibility in parallel with their youth, and also some barriers and facilitators related to health system coordination. So first, from an early age, caregivers really provide support and teaching to prepare their youth for the transition to adult care. And they can also play a really supportive role in the transition process by being the expert on their child's health history. But as youth get older, caregivers described trying to find this balance between wanting to encourage independence, but also needing to still give support. And so as youth were gaining independence, caregivers are kind of transitioning in parallel to this less involved role. And with that, caregivers sometimes worry about their child being able to self-advocate and navigate the adult system. From a health system coordination perspective, caregivers often relied on their own experience of accessing the adult services and described many differences between the two systems. These presented some barriers to supporting that transition to adult care. Caregivers found that the way that communication happened within the healthcare system could be seen as a barrier or facilitator to the transition process. Conversations around transition that were a standard part of pediatric care were helpful, but weren't happening as much in the adult care system. So again, Amanda, first we'll share a quote, I think, yes. And then Amanda will give some reflection, but this quote just really highlights the challenge that caregivers sometimes go through of supporting that independence, but also trying to hang on to the navigator role.
And so some reflection on these findings. So how everyone talks about transition really does matter. When the conversation begins about transitions, sometimes the first things that youth hear are, well, it's different over there. They're not going to do X, Y, Z with you there. And so it's frightening before we even begin. It instills some anxiety and some fear and resenting this change. So it really does matter how youth land and stick in adult care. It also affects health outcomes for those years later after their transfer. So we know that from other research that trust in the adult care provider is a key factor in successful transition, and building up that trust starts in the pediatric system. And we heard that through our findings. And then striking this balance is a challenging piece for families. It can be very challenging for youth and their caregivers to find this between support and independence, and it takes time. The concern and worry about transition really came out in the caregiver findings, but as Christine mentioned, not so much in our youth findings, where youth were even excited about this move to adult care. And so it's important to not assume how someone will feel about transition and to be ready to juggle different emotions within each family and case. And next, we're going to go through the healthcare provider findings.
Great. So the last group of participants that were interviewed for this study were healthcare providers. And so the three main overarching themes for this group were related to the knowledge and skills to support transitions, playing that navigator role for both youth and caregivers, and then of course, barriers and facilitators related to health system coordination again. So to start off, providers described some unique competencies that they needed in order to support youth during the transition process. So this included things like an in-depth understanding of how to work with youth in that emerging adulthood stage of life, motivational interviewing, assessing readiness, and having some knowledge about different change theories. Most providers described learning these skills just through on-the-job learning, as opposed to a formal learning program. Some providers described using that readiness checklist that Amanda mentioned earlier, but many providers were unaware of this type of tool. From a navigation perspective, many providers facilitated and coordinated the transition process, even if this wasn't technically part of their job description. So this would involve preparing youth for transition, attending transfer meetings and transfer clinics, and educating youth on different self-management techniques. Providers really described using a case-by-case approach and tailoring this to the youth depending on their needs. Alongside that, providers also described supporting caregivers to shift their responsibilities onto youth. And so a key part of doing this was developing a trusting relationship with the caregiver so that they would trust that their child, their youth was in good hands. From a system perspective, many different barriers and enablers were identified that impact the transition from pediatric to adult care. The importance of a culture of collaboration and working in multidisciplinary teams with team members that have different skill sets was critical to the success of transition. Providers noted a lack of connection to primary care, and the primary care providers are not commonly engaged in the transition process. The providers also identified the importance of infrastructure and resources, specifically related to communication tools to support the transition process as well. And things like transition and care letters, a transition passport, or a tracking sheet were all seen as valuable communication resources to support the transition and care. So this quote just highlights from a healthcare provider perspective the navigation role that they play. So the next slide just speaks to a data triangulation analysis that we did. So we had some really rich findings from 3 participant groups. And so we conducted a data triangulation analysis to identify similarities and differences among the findings from the 3 participant groups. And so some similarities, each of the participant groups really gained knowledge and skills in this transition process. They also identified the need of needing resources and having to shift responsibilities from one to another. Also discussed the balance of gaining independence, but also playing a supporting role. And as you saw in each of the group's findings, the need for healthcare system communication improvement. Some differences, the caregivers and providers really identified this worry of youth developing their independence, whereas youth were more excited and motivated to move into the adult care system. And youth and providers both really want that strong connection to adult care, and the participant groups are motivated to make sure that happens. I'll hand it over to Amanda to close off on this study, but stay tuned for where we took this next.
Perfect. So one youth who participated in the focus groups gave us this great analogy that I'm sure we all know well at this point, all around buying online and the obsessive nature we can take about tracking that package until it's safely on our doorstep. And so here's the quote. But the second part of what would make a good transition, I look at it as if somebody was sending off a package. They checked to see if their package landed and the people receiving it had received their package. And it was all good. It was landed, it was in the right hands, and everything was okay. And we loved this so much and thought, like, wouldn't it be great if healthcare providers knew every youth that they transferred to the adult care system, or the youth that you received on the adult end, they were landed. There was a confirmation that the shipment was complete, and it just may add that layer of support, trust, and safety that we know is all craved in times of change and transition. And so Christine's going to explain just a couple ways about how we're integrating these findings.
Yeah, so we are using these findings both in a clinical, practical way, and then to advance some of our research agenda around transitions in care. So following this work, Amanda and Jackie Pittick, who's the transition coordinator at the IWK, along with the transition and care coordinator, the transition of care committee, have taken these findings and co-designed and developed this transition framework. And it's a framework that outlines the key components to a successful transition and the role that each person plays in that transition process. And so that's kind of a practical application. And then, of course, as an applied researcher, I'm very interested in, okay, you've got this framework, you've got this intervention. Let's evaluate how you're going to implement it into practice. So we recently submitted for a TRIC grant, which stands for Translating Research into Care at the IWK, which would help us actually co-design an implementation strategy to implement this framework and then evaluate its outcomes and impact on patients, providers, and the health system. So fingers crossed for that. If we don't get it, we'll try again in the next competition or find other ways to fund this important work in the next steps of this project. Some other pieces, Amanda briefly mentioned the You're in Charge program, and you're going to hear more about this. And this is a program that's already conducted at the IWK, but timely for us, it was undergoing a big revamp. And an opportunity to inform the evaluation of this program. So Amanda downplayed this in her introduction, but she received an IWK Summer Studentship Award this past summer to lead the development of an evaluation framework for You're in Charge. And that's what she's going to present in the next couple slides.
So as Christine mentioned, this summer I designed an evaluation for the You're in Charge program. And that's what I'm going to elaborate on with you. So the You're in Charge program is an internal program run at the IWK that brings youth and their caregivers together to learn about transition and to build those self-management skills that we mentioned earlier. And those skills are going to help them manage their transition. So the objectives for the youth are to build some of those skills. So examples are knowing their diagnosis, being able to recite their medications, or even calling in prescriptions to a pharmacy, developing an awareness of the transition process. In this program, it might be the first time that youth are even hearing about this transition that they're going to go through, or it may be something that we're building on that their healthcare providers already mentioned to them. We work to build up confidence to manage their own diagnosis independently, and we let them know of various resources that already are available to them. And for the parents and caregivers, the objectives are quite similar. We focus on those self-management skills, again, building a plan for how that they can support their own youth through this transition, developing their own understanding of the process, and once again, exposing them to resources that already exist to help them navigate this change. So for the design of the study, I ran 2 co-design sessions at different points throughout. And to get things started, I ran the first co-design session with the Transition of Care Committee, identifying what were the most important outcomes that we wanted to evaluate from the You're in Charge program, taking a lead from the objectives that we just discussed. And once I did a literature search, I compiled a list of questions, and then I came back to the committee to refine that list down and to create the final evaluations. So this is an example of the format that I used to create the evaluation, highlighting that we used a re-aim framework. So this is the effectiveness section where we broke it down using the You're in Charge objectives, combining the feedback from the co-design sessions with the Transitioning Care Committee input, but also from the literature search that I conducted. And then we compiled drafts of proposed questions who went through multiple rounds of edits, but then those questions finally composed the evaluations. So there were 4 evaluations that I created from that format of the Excel, one for each of the groups involved within the program. Of course, we wanted to look at the youth and the caregivers as participants, but we also wanted to evaluate the facilitators as they're youth and caregivers with their own experience. Some come from the Transition of Care Committee, others come from other areas within Halifax, Nova Scotia. And so because they're volunteers, we want to look at how the program is supporting them and training them, as well as equipping them to successfully run the program. And we finally wanted to evaluate how the administration is equipped to support and effectively deliver the program. So the priorities that were identified from the first co-design session and really what guided my work in this evaluation. For the youth, it was greater knowledge of the transition, but also of the adult healthcare system. And so really knowing and honing in on the fact that they are going to receive a great and a high level of care in the adult healthcare system, even though they may be hearing other things from either their caregiver or their healthcare provider. We want to empower youth and build their confidence. As I mentioned earlier, one of the biggest things that came from the last You're in Charge session we ran was this concern and desire to be able to more confidently ask questions and engage in conversation with their healthcare provider in the pediatric side. And so we really dove into a deep discussion around that in a youth breakout group with youth leaders. And we also want to build on some small self-management tasks that are really applicable for them in their everyday lives, as well as their transition. And so one of the activities that we do in the youth breakout group is to develop a 3-sentence health summary, which consists of their name and some basic health information, so their age and maybe their diagnosis, their current treatment plan, but then it finishes with a question or a concern that they have. So if the youth ended up in the emergency department, they could refer to their 3-sentence health summary, with their concern being why they're there that day. But all the information is already, we encourage them to have it in a note in their phone or somewhere on a piece of paper in their wallet or in their backpack, wherever is applicable for them, so that when they arrive there, they're not trying to, recall all this information, that some of it's already done for them. For the caregivers, it was a knowledge of how to support their youth, but switching the internal narrative for them, that they can hand it off, and not to support themselves through this transition, but how they can support their youth as they look to transition. So within You're in Charge, we set SMART goals. The youth set a SMART goal and the caregiver sets a SMART goal, but the caregiver's goal needs to be a way that they're going to support their youth. So not as a caregiver that I want to let them speak more, but how am I going to support that? So my goal would be to create the space for my youth to engage in conversation with their healthcare provider, to empower their youth, or to give them hope that it will be okay. And so we do this through peer leadership, both within the caregivers group and the youth group. And so there's caregivers there that have seen their youth successfully transition that are okay. And so we really want to give them hope that, everything will be okay on the other side of this, and to help them understand what to expect, both from their youth, but also the adult healthcare system, that their experience in the adult care system might be different than what their youth is going to experience. For the facilitators, we looked at support for them. So what they need to effectively run the workshops and deliver in the breakout groups to create stimulating conversation for the participants, but to also be engaged and helpful for them, knowing of the resources that are available for the youth and their families, knowing that Jackie Piddick, who Christine mentioned, is the transitioning care coordinator, but also Lindsay McKinnon, who is the coordinator of You're in Charge. And so both of those individuals are there to support youth and their families. And then finally, we looked at the outcomes for administrators, which were the resources that are available to effectively run the program. So right now, the program is being run completely online, but eventually, if this program does transition back into an in-person led program, do we have the resources at the health center to do that and to host it? Looking at the outcomes of the program, but also looking at the referrals that are referring participants to the program, and something that the program has struggled with in the past, and something that through this revamp, we're really diving into understand the barriers that are there for healthcare providers to refer their patients to the program. So the final piece of the research study was to run a usability session. And so You're in Charge participants and some transition of care committee members all came together and took part in 2 different usabilities that I ran. They gave some feedback, and we've done a final review and edit of the evaluation. And so now it is being sent out to You're in Charge participants to gain their feedback and really to evaluate the program. And some final impacts of our integrated knowledge approach. So as a patient partner and having never really been involved in research before, I've definitely grown as a researcher. I never would have imagined I would have been able to run my own study or to do any of what I just presented to you. And I also want to add that through the whole experience, I have felt extremely valued, knowing I may not always be the most important person to be at meetings. The MSSU really supported me and made sure that I was accounted for and that I was comfortable in meetings, that I was feeling heard, I wasn't confused. It really was an amazing experience. And Christine's going to share some of her last takeaways.
Thanks. So as Amanda mentioned, this was an MSSU priority project. And so we were conducting the research, but we had MSSU providing kind of wraparound support to the research team. And so as a early career researcher, this was really critical for the development of my research program. So to have a research coordinator and a research assistant, communications, knowledge translation coordinator, helping with this project, it was really critical to the success of our research and kind of where we're going with the next steps. It was really helpful to ensure that all of our partners continue to be engaged even during a pandemic and shift to a virtual world. Another key impact of this approach, it's so exciting to see direct application of research findings in real time. I can't even keep up with how quickly Amanda and Jackie and the Transition of Care Committee are looking for the findings that they can use it to inform program development, planning with their transitions works. That's always been really exciting, as opposed to some of our other type of research maybe where it's not as applicable. And so to see that happening in real time has been really rewarding and exciting. Another piece from an early career researcher perspective, this partnership and opportunity has just given me endless research questions. Every time I talk to Amanda and Jackie and the Transition of Care Committee, we come up with new questions that we can explore. So we've got a running list. And it's been great to see the development of some smaller projects. Amanda described her IWK Summer Studentship Project. We also have a research in medicine student doing some work around the transition education programs and related to that key finding. I mentioned the TRIC grant, and we're developing some other work exploring this concept of transitions in care. So that's been really exciting and rewarding, again, from a researcher perspective.
And that concludes the presentation for today. I hope that the findings were enlightening and that our approach you were able to take something away from that. Do we do questions if there's time for questions?
Yeah, there's time.
Yes. Oh, wonderful, wonderful work, Amanda and Christine, just so amazing. And I'm sure that this will stimulate lots of questions from the group, because such a diverse amount of findings and really interesting methods that you use. So I'll just, I have a couple questions, but I'm going to open it up to others and let them all go first. Any questions for Amanda and Christine? Jennifer.
Hi, sorry, I had everything shut off here. First of all, congratulations. That is awesome work. And Amanda, I know you're going to do wonderful things that it shows. I'm curious, when you were working on the communication pieces, was any part of it through like electronic health records or some other electronic means?
So first of all, hi Jennifer, it's really nice to see you. And are you speaking about kind of our findings around the need for communication for the transition process?
No, I'm talking about the tools that they were using to communicate.
Yes, so the readiness checklist, which we mentioned in the findings, and some other tools were identified as some people using them, but they were all paper-based. So
Okay.
nothing in an electronic health record. And here in Nova Scotia at the IWK, we haven't gotten to an electronic health record yet. And so it was definitely identified as a barrier to communication, having these paper-based communication tools. And it would be seen as a facilitator if we had more electronic health record tools. One piece that I didn't go into too much detail in the findings were providers, youth, and caregivers all brought up how we've switched to virtual means with the pandemic. So Zoom and Teams and other forms of virtual teleconferencing and video conferencing was seen as a facilitator to help that transition process. Actually able to get multiple providers in the same virtual room. So that was kind of one electronic digital piece that was a facilitator, but the rest were definitely still paper-based.
Okay, thank you.
Oh, Marcia, you're muted, but I think Frank is also trying to unmute.
Oh, go ahead, Frank.
I lost all audio for a second there. Sorry. Really fantastic work, really compelling stuff, very exciting to see it move forward. I think one of the seeds I just like to plant with you guys as a research team is even thinking about the healthcare system costs as being just a real possible driver for a lot of this work. Because having people lose contact, it's you're doing the right thing for the patient, but it's also the right thing for the system as well.
Right.
Because it keeps people engaged, keeps people healthy longer. It doesn't turn into a thing where they stop care and then come back when everything goes off the rails. Type of situation. So yeah, fantastic work. Great to see it. Well done. And for a project started in the summer kind of thing, that is brilliant. Really, really strong work.
Thank you.
Thanks, Frank. And yeah, that's a good reminder. And speaks to one of the findings around this loss to follow-up that providers were seeing, especially in the adult care program, of kind of 3 strikes and you're out as a rule. So if you don't show up 3 times you're off the roster and you have to get a new referral. And so just that whole process and the cost of that speaks volumes to the transition process.
I had a colleague who did work in pediatric cardiac care and things like that. So a lot of really kids with a lot of very serious issues, and he was astounded by how many people just kind of fell off the roster.
Yeah, really discouraging. And so in our next phase of work, so this work was very PEDS driven, and just the nature of the project, and in this kind of subsequent work that we described in terms of the transition framework, we've gotten some great partnerships going with more of our adult care colleagues, so that it's not seen as only a pediatric issue, but the role that the adult provider plays in all this. So that's encouraging for next steps.
Excellent.
Thanks.
Yeah, excellent. And Kathleen, I think you have your hand up. Welcome.
I do. Thank you. I don't have any wonderful questions to ask, but I can't help myself. I have to note, from a research administrator's perspective, seeing a presentation like this, understanding how our programs were able to support and encourage you to do this work is so important. I think, as you mentioned, in real time, we don't often get to see how the offerings that we try to put out there to encourage research has a direct impact on patient care, in that real time momentum. And it's incredibly exciting. Really great work. Congratulations.
I am very proud of Amanda. And so it's nice to hear from the researcher administrative perspective, like you, Kathleen and Frank and others, that you're equally proud. So that's great.
Wonderful.
And a great opportunity to highlight some of this work as wonderful examples, Kathleen, for others to realize what, that all of the research that we do is always sort of a logical movement from one thing to another, but how various things within the institutions are so essential to starting that cascade of very important work, and how it impacts so many people, not just the learners, but patients and families that we serve. And I see that, Julia, you had put something in the chat. I don't know if you want to actually ask your question or if you prefer me to ask it.
I can ask it. Yeah. Hi. Really interesting work. I am working on transition of care within the pediatric oncology setting. And so I was wondering what kind of conditions or diagnoses were included in the study.
Amanda, do you want to speak to that one?
Sure. So the 3 population groups we looked at were juvenile arthritis, IBD, and diabetes. Yes. And then there were, for recruitment purposes, Christine, did we expand?
In the end, we expanded a little bit more beyond that from the youth participant perspective, but the healthcare providers were within, juvenile idiopathic arthritis, diabetes, and irritable bowel disease. And a little bit more context of why those were chosen, I mentioned very briefly, but there's another kind of arm to this work, which is a quantitative health administrative study that's being led by MSSU, looking at healthcare utilization rates. And they had to pick 3 conditions in order to develop the algorithms for the health data analysis. And so from the outset, we said, okay, let's try to do the qualitative study in the same group so we can do some comparison down the road. And so that project is still ongoing, so we don't have any results to share from that comparative analysis just yet.
Thank you. Yeah, that makes sense. And I think that's an amazing approach to kind of tie those two, like the quantitative and the qualitative evaluation together, so you can triangulate those findings as well. Yeah, like great work for sure.
It'd be really interesting to hear and chat sometime, Julie, about similarities or differences from a pediatric oncology transition perspective.
Yes, for sure. I will definitely, I think your name has been mentioned a couple of times actually when I presented my approach to the work. So we're trying to define successful transition of care from long-term, like for long-term follow-up care. So, you know, when pediatric oncology survivors are transitioned to their primary care provider for the long-term care from their hematologist or oncologist. And it's a little bit different because I don't know, like I'm very interested in other pediatric conditions, but I always find that the peds survivors are a little bit different because they technically are not cancer patients anymore. They are just at risk for so many late effects and need to be monitored and have, you know, ongoing needs. And yeah, so a little bit of a different transition there. But yeah, like very excited to connect. Thank you.
Thanks, Julia.
Great, thank you, Julia. And Jennifer, you had a question. Do you want to ask it or should I? Jennifer was wondering about what age range the youth that involved were.
Amanda, do you remember the exact? Was it 14? That was the earliest. I had to pull up our.
I was gonna say, I was hoping that you'd remember when I saw the question come in.
I do know that it was, I'll have to double check for you, Jennifer, but I think the youngest was 14, but it was more focused around either going through transition or have transitioned within the last 3 years to get that, that understanding of the experience.
And most of our groups transition at 16 years. There are a couple who are closer to 18, but 16 is generally the cutoff, right? For most of those groups. So
and that's different from province to province, but yeah.
Yeah, so it sounds right that 14 would be getting ready and maybe up to 18 or 19 for those in the last 3 years. Excellent. And Rick and Ass, I don't know, do you want to ask your question?
Yes, sorry, my name I can't really change within the meeting here. I'm Haley. So my question's like more related to if there was any technology or digital resources that were used to facilitate the youth's transition of care, and if that was like a component that was evaluated alongside those other key players such as caregivers, healthcare professionals, and the youth themselves to sort of see how that can be combined to help with that transition.
Sounds like a brilliant next study. It was not something that we studied in this work. The idea of different digital resources, apps, you know, transition passports, those came up in the conversation of, you know, dreaming big, what could help with this, facilitate the transition process. But for this project, they weren't evaluated or their impact wasn't assessed on transition of care.
Another interesting piece of work that's being done in Alberta, I was just at a conference in the Yukon and they presented a digital escape room to help youth through transition. And so I participated in that breakout session, but that's also something interesting that we could look at as a digital resource.
Very cool.
Well, that sounds kind of fun. A great way to engage people.
Yeah, it was new and different, which I think could be really useful.
And for your and definitely when you think about the evaluating the resources, you know, working with colleagues, of course, in informatics and human computer interface and all of their skills with sort of helping with evaluation and preparation is an excellent new study, Christine and Amanda. Any other questions or comments from the people who are attending? Well, I just like to say, you know, in summary, I think, again, it's just such an excellent and exemplary demonstration of again, utilization of various ways to get funding to move forward. An excellent demonstration of participatory, co-design, co-leadership with patients and inclusion of healthcare providers and all of the perspectives in that it's youth caregivers and providers, and just such a timely and important element that also has such relevance, not only in our pediatric populations locally, but we've heard both with respect to the oncology groups. And also, I mean, as I sit here, I mean, I think about, even though I'm at the early end of the spectrum with neonates, but I think about even transitioning, elderly and moving into different care facilities, and much of what you learned and how you do it and your methods are so informative. So I also see, just before I finish, I see
No, it's really
Julia.
good. Yeah,
Julia
sorry.
had one other comment.
I had a question, and it goes back to some of the slides I picked up on. You said something along language matters, and I wasn't quite clear what you meant by that.
So when we talk about the language, it really was the way that healthcare providers were speaking about the transition, and even caregivers. So caregivers, being adults, would have their own experience within the adult care system. And as they're, sitting around the dinner table talking about transition with their youth, my experience was even like, oh, it sucks. It's slow. No one cares. And so before I'd even gone to my first appointment, that was the impression I had of the healthcare system. And so we see the same thing can happen in clinic. So that language, that letting the youth gain their own perspective and own experience within the adult care system, and not labeling it. So, and we compare it like out of healthcare to when high school teachers are going to transfer their youth to university, that like they won't baby you and you're going to have to do more work and be on top of things on your own. So that kind of negative connotation that sometimes is given without knowledge, without awareness. That's kind of what we wanted to highlight with the language piece.
Yeah, that makes a lot of sense. And I think it is very important to not have kids biased, right? Like to not have them be, approaching, or like they're approaching their care with this bias that they might have overheard from their parents or from others. Yeah, thank you for clarifying.
Absolutely. Yeah, no problem.
Excellent question, Julia. I know in the work that we've done that we include a lot of feedback from our patient and parent partners. I think the insights that when we ask, not only in our recruitment materials, but how we explain our findings, how we speak in meetings, the insight that I've learned from listening to the people that we're actually trying to serve has changed so much in how we speak, but also how we write. And so again, just a wonderful example. And if there is is there any other comments or questions? Otherwise, we have 2 minutes. I just want to thank you so much, both Amanda and Christine, sharing this wonderful work. We look forward to hearing the results of your successful trick grant. And thank you everyone for joining. We'll see you again in a couple of weeks, and take care and have a good day.
Thanks, everyone.
Thank you.